James joins us today on the Tinnitus Relief Podcast to share his story. He first developed tinnitus almost 2 years ago. He started working with our team at Treble Health. That's how James and I got introduced to each other. And it's been 9 months since he has worked with us. James, where you are today compared to where you started, what percentage better are you today?
75% better today than I was when I started working with Treble Health 9 months ago.
And when you started working with us, how would you rate your tinnitus on a 1 to 10 scale, 1 being not a problem at all, 10 being an extreme problem?
Most of the time, it was between a 7 and an 8 on a scale of 1 to 10. So it was pretty bothersome, pretty severe.
And does that fall now?
Between 1 and 3 most days.
Okay.
And I've had quite a few days recently when I would have, at first I would have a day here, a day there. Now I'm having several days in a row where it might be 1 or 2.
Okay.
So,
Excellent progress. That's what we like to hear.
Mhm.
So
Yeah.
has the loudness changed over time? And tell us about your perception of the loudness or the intensity of the sound that you've been hearing.
It definitely has changed over time, the loudness and the intensity both. And I would say that, the intensity is something I can only describe as kind of a congestion, a noise congestion. And it feels very tight when it's intense. And that has really ramped down, and the noise level, as I said before, has dropped significantly. And that started within the first, I would say, month and a half after I started using sound therapy. So it was very surprising to me that it happened so fast. And it's, although progress has not been linear, and I was told that in the beginning that it wouldn't be, it's been steady. You may take a few steps back now and then, but then the steps forward that you take always bring you back to, yes, it's working. This signifies that something's going on that's positive, and you focus on the positive changes, and they keep happening. They're happening still this week.
Living with tinnitus can be incredibly challenging. The constant ringing in your ears and the frustration of not finding relief. Hi, it's Dr. Ben Thompson, founder of Treble Health. Back in 2020, I started this YouTube channel because there were so many people who were struggling to find help for their tinnitus. As the channel grew, I decided to offer tinnitus solutions directly to patients, all from the comfort of home via telehealth. Today, our team at Treble Health is recognized as the nation's leader in tinnitus care. I'd like to introduce the Tinnitus Relief Bundle by Treble Health. Our bundle is backed by science and designed to provide long-lasting relief from tinnitus.
I feel like Treble Health literally gave me my life back. I was questioning my entire future and what it would be like, and now I no longer question that at all.
Imagine getting back to living a full and productive life. Treble Health's Tinnitus Relief Bundle can help you find the relief you've been searching for. Visit our website at treblehealth.com/bundle to learn more and start your journey towards tinnitus relief today with a risk-free trial. Plus, mention that you came from YouTube and you'll get our top-rated tinnitus sound machine for free. Treble Health. Relief from tinnitus starts here. Part of our mission on the Tinnitus Relief Podcast is to share inspiring stories and provide real advice. So what is your advice to someone who maybe has been living with bothersome tinnitus for 6 months or 1 year? I look at your story and I understand that for about 1 year, you were not working with our team. And I want to learn more about that. What happened during the first year? Were you following the wait and see approach? Were you actively looking for solutions, but didn't find much help from local doctors? What happened during that first year? And how was it managing your tinnitus? Were there any positive changes during that first year before you started working with our team?
I wouldn't really say there were positive changes going on at all the first year. There was a lot of fear, a lot of anxiety, a lot of professionals telling me that basically there was nothing I could do about it. And I saw several doctors, a variety of people. I saw an ENT, I saw a general practitioner, a neurotologist, a neurologist. I had MRIs, I had a CT scan, I had eustachian tube function test, I had audiometric testing, all of the things that you would, want to do to find out if there's anything going on that you can fix. And as I found out, I had several possible causes that I didn't know about. So I was glad that I did all the testing. But one thing that was, a through line, one thing that was common with all these professionals is that they really didn't give me much hope. They said, okay, well, you've got this going on, but we really don't know that much about tinnitus, and it's doubtful that it can be managed or eradicated. It might go away, but you'll have to wait and see. So the wait and see that you talked about was basically something they told me to do. And after a point, I wasn't willing to do that anymore. I had been given benzodiazepines, Xanax initially, which really didn't do anything for me. I was on that for about a month. And then I was given clonazepam, and that was a very, very bad thing for me. And I'm not advising people in any way to not take it. I'm saying be very careful when you talk to your doctor about it, because I'm right now still tapering off of that because it turned out that I had a sensitivity to it, and I could only reduce tiny amounts at a time. So right now I'm at 22 milligrams a day, down from, I was taking two pills, two 50 milligram pills a day. So I know that's been a factor that I've had to deal with the whole time, that, probably if I'd known that this was going to happen, I wouldn't have done it. But anyway.
Definitely. Totally agree with you. So talk to us more about your symptoms. For those who are listening, who are on our YouTube channel or listening on our podcast, we may be asking, does James experience what I'm experiencing? Because if you found a way to get 75% improvement, within a 9-month period after you had the condition and it was bothering you for about a year, I want to learn about what you did, but first let's try to understand what exactly were you experiencing. What I know as a tinnitus specialist, as an audiologist, is that there's dozens of descriptions that a patient can have to describe tinnitus. So ringing, buzzing, hissing, roaring, electrical noise. Those are some of the more common types. There can also be some pulsating, some heartbeat perception as well. Tell us about the symptoms that you have been experiencing over time. And what exactly do you hear coming from your ears or from your head?
Initially, what I heard was a whooshing that seemed like it was at the base of my neck. It suddenly traveled into my head and then seemed like it was in my ears. And my ears felt very congested with noise. It sounded like a hissing, like a field of cicadas, really. It was a very metallic sound, almost like a high-pitched train on tracks, metal on metal sound. And that was the initial presentation of it. About a week later, I woke up at 3 o'clock in the morning and it was pulsating. And that's when I got really worried. And I went to the urgent care facility that morning, and they did an MRI, found nothing wrong. But I should tell you that at 3 o'clock in the morning, my wife found me in the kitchen with my head in the kitchen sink with the water on full blast, because that gave me some relief. And so I was, I got some relief from running the water. And the first few weeks that I dealt with it, that's what I would do. And I don't advise that. Our water bills were terrible. But anyway, I had the MRI. I told them that I was having the hissing, the high-pitched ringing, the metallic sound, all of these things. And then, and now the pulsating. So they told me I had pulsatile tinnitus as well as non-pulsatile tinnitus. And that's been a real challenge. But it's funny how sometimes the pulsatile part of it is there along with the non-pulsatile, and sometimes one or the other is there by itself. So I never really know what I'm going to get from day to day. But these days, when I wake up in the morning, I have to wait about 30 minutes, maybe 45 minutes to find out what it's going to do. So then I can set my sound therapy. And that's what I do. And that works for me very well. I find that if I set it right away, sometimes I wish I hadn't set it where I set it. And the rule is in everything I've read and everything I've been told is you set your sound and forget it. You set it unless you have sound sensitivity. And I've gone through some bouts with that, and that's much better now. But I've had all of these, you mentioned hissing, ringing, buzzing. I've had those things, the metallic sound. It really didn't settle down, so to speak, until probably 4 or 5 months into it. And then it was mostly a high pitch, pulsating sound with a kind of a whooshing or electrical sound underneath that sometimes.
Got it.
And that's
And
basically what it is now.
and of course, you're sharing the story of positivity and change, and
Right.
I know that you put a lot of work in as well. This wasn't simply a passive process. You
Right.
mentioned that one of the first tools to provide significant relief was sound therapy, and
Yes.
You earlier mentioned about a month of using it consistently with us at Treble Health that you noticed things started to change. So tell us about that for someone who's listening who might have maybe listened to some YouTube videos about sound
Yeah.
therapy, but doesn't really know what it means to get professional sound therapy. Could you explain about your experience there in the first month?
Sure. Sound therapy for me was really key to getting better. I think that was the single most important thing that I did. And if I'd known how much it was going to help me, I would have done it previously. But when I first talked to an audiologist in, I think it was December of 2021, that person really didn't explain how sound therapy worked. I was left with the impression that you basically use it for your whole life and it masks your sound that you have going on. And I thought, well, you're just replacing one sound with another forever and ever. I don't think I want to do that. So I didn't go to that person. So I had a mistaken notion of what sound therapy, how it really worked and what it could really do for you. But once I got started with it, and it took me a couple of weeks to get the devices, the ear level sound generators, which I'm wearing right now. You can see these little things, they fit right behind your ear, and then the little dome goes right inside your ear canal. Very unobtrusive. You hardly notice them, but they provide this constant soothing noise that actually, at the mixing point, it really does take away from what's going on inside your head, if there's anything there, your tinnitus. And over time, you notice that your tinnitus is getting less noticeable. And I started noticing that, as you mentioned, about a month and a half after I started using sound therapy. One morning, I was just sitting there and drinking coffee. I do drink coffee. Hasn't really seemed to affect my tinnitus. Some people it does, but I didn't hear anything except my sound that was coming from the sound generators. And that was the case for a couple of hours. And that was the first time I realized, wow, there's something going on here. It really kind of makes your brain is the jury. And you did an excellent YouTube video on that. Brain is jury. And your brain kind of over time decides what's important. And it compares the two sounds. It compares your tinnitus to what you've got coming in constantly from your sound generators. And eventually your brain refiles your tinnitus. And that's what's happened to me. It feels like my brain has put it in a back filing cabinet somewhere. And I know it's still there. If I really listen for it, it's there, but it's in the background and it doesn't affect me like it did in the beginning. It's not a noise that causes me any fear or any anxiety anymore. It might be unpleasant at times. I may curse at times when it, when it starts, and like, oh, that again. I'm at stage 3 of habituation right now, and I stayed in stage 2 for quite a while, but in the end of March, I believe it was, I suddenly realized I was at stage 3 because I was going for longer and longer periods where I didn't notice tinnitus at all.
So let's go ahead and put that up on the screen right now.
Mhm.
And if you're watching on YouTube, you're going to
Good
see the
idea.
4 stages of habituation. We also describe this as the 4 stages of relief. Stage 4 is the goal. This is where we're headed. And using sound therapy, having tools, having resources, getting help can allow us to get to stage 4 of habituation. Habituation describes the natural brain process by which we can reduce the perception, awareness, and often the volume of tinnitus over time. So most people who are in need of help for tinnitus and reach out to our team at Treble Health, for example, are in either stage 1 or stage 2 of the 4 stages, where there's eye awareness and annoyance of the sound. It's often accompanied by loss of sleep, anxiety, stress, hyper-focusing, and it can be very intrusive. So now circling back, James, to your comment, you touched on a few important points. I think that one of the most common questions that patients ask us is, does sound therapy treatment with those tinnitus maskers that you had on the ears, right? You got those through our team at Treble Health.
Yes.
And how that worked is we put them in your ears and we program them based off of a hearing test that you had completed. And then we adjust them over time. As your tinnitus gets better, we can adjust those devices through remote care, through telehealth. And then on your side, you also have adjustments that you can make from buttons on the devices as well as through the app on the phone. So that's essentially what these devices are. Those are medical devices for tinnitus. So a common question that we hear from our community is, does that cure tinnitus? Does this sound therapy treatment cure tinnitus? And at the end of the treatment, do you still need to use the devices anymore? Or what happens then? So you address, no, at the end of the treatment, you don't need to use the devices anymore. You can take them off and you don't need them, and you'll be able to be in quiet environments and have that peace and not be affected by tinnitus in any bothersome way. Does this cure tinnitus? It very rarely brings tinnitus to zero. So the answer there is no. Most often, this does not cure tinnitus. However, if one can reach 75%, 80% improvement with their tinnitus, that's a goal worth working towards. That's going to change many lives to have that kind of improvement. So
Absolutely.
That's what we're after. We're not after a cure. Most people don't need a cure, because when we can bring it down so low, then it's at a level where someone can live a full and productive life.
Right. Right. I couldn't agree more. And for me, it's a virtual cure because I never expected zero. I don't think anybody alive, really and truly, if they're in a room with no other sounds, that's a special room, that's padded. What is that called
They're
anyway?
called sound treated rooms or soundproof booths.
Yeah, I guess I've heard a word for that.
Anechoic chamber.
That's it. Right, right. If you're in there, I've heard that 94% of people hear tinnitus. And so I never expected zero. I just wanted a reduction. And I got a reduction within the first month and a half. And so I realized, wow, if I've made this much progress in 6 weeks and I stick with this is going to be my ticket to taking back my life. And I didn't feel that I was in control of my life when I first had tinnitus. I think a lot of people don't. Bothersome tinnitus, that is. My sister has had tinnitus off and on. She had Meniere's syndrome when she was young. It somehow went away, and it didn't bother her the way it bothered me. We're just different. And hers was different. And I was checked out for that, and there's no evidence that I have anything like that. But
Yeah.
And she's gotten better over time. But there are so many, people are different. Some people are bothered by tinnitus, some aren't. But then you can't tell what they're hearing either. That's part of it.
So another common question we get is, well, how much time does it take if one can improve their tinnitus? And if I know what the end result here is of getting to that stage 4 of relief, the stage 4 of habituation, where I don't need to use the devices anymore, how much time does this take? So typically I counsel patients, hey, realistically, expect this is going to take 6 months or more. And based on the individual, this could be 6 months, this could be 12 months, this could potentially be, about 18 months. There's nothing that's going to work as well as this. So in some ways we have to surrender and accept and say, okay, this will take time. I'm going to ride it out because I know that the work I'm doing now will bring my baseline levels of tinnitus down to as low as they can go. You now have been working with our team at Treble Health via the telehealth remote care with the devices on the ears, the sound therapy treatment, as well as one-on-one with an audiologist in our team for the one-on-one sessions to address the anxiety, stress, tinnitus, fight or flight loop. So what is your answer to this? How much time does it take? And any advice for others who are asking that same question?
Realistically, I think some people might get lots better in 6 months. By the end of March, when I hit stage 3, and that was only, I've actually been doing sound therapy for 8 months because I don't count the first few weeks. It took a while to get traction there, but let's see, I would say November, December, January, February, March, 5 months, and I was significantly better. So within 6 months, my life had changed, and I feel like I'm getting better and better now. And I want to stick with it for a few more months. I'm not at stage 4 yet. I'm not to the point where most of the day I don't think about it, but I anticipate being there this year sometime. I don't think that's unrealistic. That by the first of the year, I might be at stage 4.
I want to address something with you. First of all, I'm really happy for you and happy that you're feeling better and that you're on this path and, and that you're giving back to the community. So on behalf of all of us, we say thank you. And if you're watching here on YouTube and this has been helpful so far, please comment on YouTube, helpful, write a comment there below so that James and I can know. What someone who's listening might be thinking is, James, I can't afford to wait 6 months. I need help now. I need to get better soon. Yes, I want to get better and I want to reduce my tinnitus over time, but I need relief now. Is what you're describing that the tinnitus maskers, the sound therapy on the ears, it took 6 months to work, it took 1 month to work, or in the first few weeks or even moments of using it, did it provide some immediate relief, just like when you were really struggling and you would go next to the sink at your house and you would use sound to provide some relief? Does the sound therapy in the ears, in your experience, provide some immediate benefits as well?
Absolutely. You're going to get some immediate relief from the sound therapy. And that's, I think, part of the point of the whole thing is to relax you and let you focus on getting better and not be so fearful and anxiety ridden. Because if your limbic system is in overdrive, your progress is just going to be curtailed. And so yes, I think absolutely sound therapy can help immediately. In my case, I started out with what they call pink noise, and it wasn't my favorite, but it was working, and so I stuck with it. Now, later on, my sound changed somewhat, and my audiologist, Dr. Sarah, crafted a new sound that had violet noise and pink noise, and that's been a game changer because that's provided me a lot more relief than the pink noise ever did. But the pink noise was immediately something that took the edge off, and that's very important when you have so much anxiety and fear about your condition. So I was grateful for it. And it just brings up the point, though, that if you notice that your tinnitus has changed, that the sound therapy is not as effective as it used to be, talk to your audiologist right away because there's something they can do. And this certainly was the case with me. And I told Dr. Sarah just last week, this really is amazing to me because the pink noise had really kind of outlived its usefulness by itself. And when I got onto the new blend, I started making progress again right away and have been ever since.
Let's take a moment here to just reflect on your story again, James. You first developed tinnitus almost 2 years ago. You found us at Treble Health. You worked with us online. We have this remote care telehealth service. And it's been about 9 months since you started working with us. In that time, you've noticed and experienced 75% improvement, which we celebrate and are very grateful and happy for you and your health. And that on a 1 to 10 scale with your tinnitus, you'd say right now it was between a 1 and a 3. Was that correct? Is that what you said? So
that's correct. And a lot of days, really 1 or 2, but I would say never more than between 1 and 3. Well, I don't want to say never. When I wake up from a nap, and I know a lot of people say this, I notice a fluctuation, and it takes a while for that to go down. But one of the first things that you'll notice when you use sound therapy is that your fluctuations aren't as long and they're not as severe. So that's gotten better over time too. I don't have as many fluctuations, and the ones that I do have are not as pronounced as they used to be.
Excellent. And you had also mentioned that over time, the loudness of your tinnitus changed. So this is not just I'm not hearing it as much, I'm not bothered by it. This is the intensity of the sound has gotten better. So what I'd like to think is, all right, ENT doctors, audiologists, the internet that creates information about tinnitus. Let's come back to James's story here as one example of many that there is something you can do about tinnitus. And if we can change the belief or the mindset or the understanding of the millions of people that have tinnitus, there is something that can be done, and the doctors that are seeing these patients in the clinic, then we're doing a great service. And it's definitely our mission here with the Tinnitus Relief Podcast, as well as our telehealth service at Treble Health. Let's add some last words. James, any last words for motivation or encouragement for those who are in need of help?
Yes, the first thing I would say is read about neuroplasticity. That's real and it's very powerful. And it's gotten me to where I am right now, and it's something that you really you can't stop once it starts, and you're doing the right thing with the sound therapy and counseling, education, everything else. It will work for you. And I think probably the most important advice I could give anybody, just 2 words: keep moving, figuratively and literally. And by that I mean, you want to avoid sitting in the chair just ruminating about tinnitus and thinking about it and listening to it. Do meditation. That's really helped me. Even walking meditation. There are a million things that you can do, but keep moving and keep your mind focused on things that, it's funny. I used to watch commercials about pharmaceuticals with people gardening, and I would make fun of all these happy people gardening after they took whatever pill it was. But that was one of the first things that I didn't want to do anymore when I got tinnitus, is I didn't want to work in the yard. And I was like, I'd give anything to be able to feel good about going out in the yard and doing work. And so now I understand why they put these people gardening in all these commercials. Well, do things like that. Do things that make you happy. And just that, keep moving.
Thank you so much, James. My name is Dr. Ben Thompson, founder of Treble Health. You can find our work at treblehealth.com. We have the sound therapy treatment from the leading devices that are available direct to you, the patients that we work with. We also have one-on-one services. If you already have tinnitus maskers or hearing aids, you can work with our expert audiology team, and we specialize in tinnitus. We also have knowledge on associated conditions like hyperacusis, sound sensitivity, and hearing loss. Thank you so much for listening to the Tinnitus Relief Podcast. And James, we'll have another update from you sometime down the road. Keep it up.
Thank you, Dr. Ben.